Hey, Facebook family, I'm Dr. Brian Adkins with the Adkins Academy. I want to thank everyone who has joined our program in the past, but also everyone who's taken our course now. We just had a science class, quite a few people in there. We went about 10 hours. Thank you all for being in there. It's really went over a lot of great material, a lot of great concepts that you definitely need to know, not only for the TEAS test and the HESI exam or the PACS and NLN, but also for the for nursing school. And so we talked about a lot of real concepts, real content, real patients, and it was a great course that we had on yesterday. But I just wanted to give you guys some answers for some of the questions of the week that we've been doing. Love your responses. Angelisa Walker gave us a great response. Maggie Faven also. Micaiah, definitely appreciate your responses there, but also our Instagram and Facebook and Twitter responses. We really appreciate those responses and engaging with us on these different platforms. Definitely love working with you all. And so let's just take a look at one of the questions here that we had, which is which gland is responsible for regulation of calcium levels, I should say. And so we had again several answers, several people chimed in with some answers, maybe A, maybe C. In terms of the answer choices, we had parathyroid gland, the pituitary gland, the adrenal gland, or the pancreas. And so, we can definitely break some of these down really quickly, but we had a lot of engagement there there also. But in terms of this, certainly the parathyroid gland is what we're talking about. So the parathyroid gland is located on the posterior end of the thyroid gland. And so the parathyroid gland releases PTH, parathyroid hormone, that is going to basically increase the absorption of calcium from the food that we eat in the GI tract, but also decrease the amount of calcium elimination at the kidneys in the distal convoluted tubule. And so, plus it also obviously works on, I should say, the osteoclast to break down the bone so that we can actually put more calcium into the bloodstream. And so those are the main three things that parathyroid hormone does to increase and upregulate the calcium levels. The counter to that would be calcitonin, which comes from the thyroid gland. Okay, but the pancreas is going to be more so for endocrine and exocrine functions, including insulin and glucagon for the endocrine, but also pancreatic enzymes that are going to go into the GI tract to break down a lot of the food and things that we eat and give you those macromolecules. And if you don't know what I'm talking about, definitely take our science class. You will understand all of this in very great detail. The adrenal gland, lots of different hormones coming from there. Certainly cortisol, norepinephrine, and epinephrine. And so, again, we'll talk about that during the science class if you join our program. But also, the Renin-Angiotensin-Aldosterone System is also associated with that. Also, we'll talk about that in great detail and talk about how some of the treatments that we use right now today to manage high blood pressure and cardiovascular pathologies, how we use a lot of those, how we lose a lot of drugs, I should say, that target the things that come directly from the adrenal gland. And so ACE inhibitors, beta blockers, those types of things. And so again, we'll connect the dots for you there with our science class. And certainly with the pituitary gland, very, very important gland, but that's in the brain. It's going to, the anterior pituitary in particular, is going to control a lot of the other target glands. And so again, we'll go through the entire endocrine system during our science class, but we'd love to have you a part of that class as well. So definitely join us for our next science class. We will go through all of that and then some with you to make sure that you understand, not just memorize, but you understand how life works. What does life mean? People have taken my science class. They certainly understand what I mean by that term, because throughout the entire class, I explain to you, this is what life means. This is what it means to be alive. This is what makes you different from the person who is in ICU, who has just died. And so if you want to understand life in that context, certainly give me a call. Let's talk about our science class. But also, we do the same thing for our reading class, our English class, and also our math class. You will certainly understand how to approach the questions. You will understand how to get to the answer, how to eliminate answer choices, but even more importantly, how to apply your knowledge. That's what we talk about when you do classes with the Adkins Academy. I don't just put up charts and diagrams and flashcards for you to memorize, but I help you to understand how the information can really help you to not only answer the questions on the test, but how you can actually apply this to your life, into nursing school, into medical school for that matter, but also how to apply this to your patients. That's what's most important. All right. Thanks a lot for joining in. We'll try and do this again next week, Monday, and I'll see you next time. Thanks for chiming in, everyone. All right.